Hi, my name is Tanisha Del Valle. I am currently a student at Stanford University. I'm currently a nursing student. I am going to be doing a speech to discuss the proper hand hygiene practices in a healthcare setting. So, the proper way to wash your hands and what you can do and what you can't do, and what you should do, and one of the little things that you should be using. So, did you know that the improper hand washing techniques is one of the leading causes of healthcare associated infections, also known as nosocomial infections? We learned the hard way during COVID that is one of the most effective ways of preventing the spread of infections, spread of germs, is to wash your hands. Again, according to the CDC, some healthcare personnel may wash their hands up to 100 times a shift. So, my credibility related to this topic is I currently work as a respiratory therapist at a hospital in Anaheim, and I can personally attest to washing my hands at least 5 times an hour. It depends what my patients are on, isolation wise, if what I'm doing, if I'm just giving medication, or if I'm handing them like an intensive spirometer, or if I'm giving them tissues or something, because I do just do little basic things. So it also depends. If I'm obviously giving them like a breathing treatment, if I'm helping them by touching them, I'm gonna go wash my hands right after, even if I'm wearing gloves. But again, depending on what kind of isolation they're on, it's really gonna tell me if I'm gonna go wash them in that moment or if I can use hand sanitizer. So again, I probably use hand sanitizer at least 25 times an hour. It depends how many people I'm seeing. Sometimes I have up to like 18 patients. So that's at least, I would say at least like 12 treatments that like, or at least like 12 medications that I need to give, well, 12 people that I need to go give to. So I am going to be putting on hand sanitizer at least 12 times in that hour. So 12, and then I'm putting it on before gloves, after gloves, in between each patient. So that's 24 in just that moment. But again, I'm putting it on if I'm gonna go grab something, if I'm gonna touch my computer, if I'm gonna touch my pen, once I grab my stethoscope, my pulse ox, my pulse oximeter, no matter what I grab, I'm constantly putting hand sanitizer. So again, my hands are very dry. I try to use lotion, doesn't work that well, but yeah. So germs can spread pretty quickly. A good hygiene means regularly washing with soap and water at least for 20 seconds and allowing time to dry if you can. If not, most importantly, dry your hands. Because if you don't dry your hands, then it's actually easier for infections and germs to spread with wet hands. Because again, dry surfaces are less are less frequented by germs. Again, so alcohol-based sanitizers with at least 60% is good if soap and water is not available. So, according to USDA study, 97% of people don't properly know how to wash their hands, or they may just not wash them correctly most of the time. So that may be just with soap and water. I mean, sorry, no soap, just water, a quick little rinse, because it has to be at least 20 seconds in order for it to be effective. Warm water is the best. Cool water is acceptable, but again, the warmer the water, if not a little bit hotter, a little bit more than warm, but that is better to kill the germs that are on your hands. Michigan University study, according to the CDC, found that 33% of people don't even use soap when washing their hands. And well, hand washing obviously benefits the whole community. It reduces respiratory illnesses by 21%. People with diarrhea who often get sick with diseases that cause diarrhea, it reduces that by 31%. And people with weakened immune systems by 58%. So the population basically just needs to be better at hand hygiene, and they need to learn how to wash their hands or at least sanitize them intermittently. So today I will be demonstrating the proper technique for hand hygiene and basically what healthcare professionals use to reduce nosocomial infections. So again, as nursing students or soon to be nursing nurses, hand washing is going to be the vital, if not the most important thing that we do throughout the day. It's going to be part of the daily practice. So lotion is going to be very important. Again, so by step demonstration, we are gonna have water right here. Gonna turn it on to the hot setting. Then we're gonna wet our hands just a little bit, make sure they're nice and wet. Grab some soap. We're gonna go from the back, our palms. Make sure we get under our nails. I usually, since I actually have nails, I actually rub them with my fingers. So you're gonna want to do this for at least 20 seconds. You can sing the happy birthday song. That's the 20 seconds of the CDC recommendation. Uh, again, and then you're just gonna lather, rinse, and repeat. You don't have to repeat, but lather and rinse. And then you're gonna grab a paper towel. Usually grab two because one doesn't dry my hands well enough. Okay, you're gonna get back of your hands, your wrists. Gonna go under your nails, dry everything off. And then again, so make sure you get your nails, your wrist areas. Those are all important areas that you need to clean. A single gram of human feces can actually contain 1 trillion germs. So it's important to do, especially after patient care. Possibly during after medications, it might be okay to just use an alcohol-based hand sanitizer. So again, when soap and water may not be readily available, when we're just working, we're switching gloves quickly. Say a glove pops, hand sanitizer, new glove. Uh, Possibly when assisting with someone from coming back from the restroom. Again, someone like a patient, you could do hand sanitizer, then go wash your hands real quick. It's always just a good practice to just put some hand sanitizer. If you're gonna go wash your hands after, there's hand sanitizer in every room, every corridor, after every patient room. There's so much hand sanitizers throughout a hospital. So that's something that you should not have to worry about. You should always be able to find hand sanitizer. So again, you're gonna want to use hand sanitizer if you can't readily get to soap and water. You're gonna apply enough product. Oh, that was a lot. To cover all the surfaces of the hands. And then you're gonna rub your hands together until they feel nice and dry. You're gonna get under your nails again. Make sure it's all on there. It's kind of strong. On your wrist area. And there you go. Nice and dry. So again, always a great solution. I would just keep one in your pocket, even when you're outside, when you're eating, when you're going outside with your family. It's just you should constantly just have hand sanitizer because it's the best line of defense rather to nothing. So, in conclusion, overall, hand washing is the most effective way to prevent the spread of germs. But again, when you can't get to that, it's always okay to just use hand sanitizer. It can continuously transmit infection if you don't use hand sanitizer, don't use practice your good hand hygiene. So let's always remember that we must use this. and wash our hands. Thank you.